I don't want to wait too long because I know it's already the last session of the day and it's a bit long, and I hope we can get you all excited. This is a very big room, but we will try to be very interactive and to also share insights, what has not been shared before, and maybe can give us some key messages to take away. So first of all, thank you so much for coming to our session. I would like to really start briefly by introducing this important panel we have here for the session of Sustainable Giving for Global Health, the Strategic Pathways. I am going to be a bit, I would say we have spoken, of course, before this session, so I consider them as my colleagues, my friends. So I'm going to be a bit informal here. So I'm going to drop the doctors, the professors, and just pronounce everyone with his first name. So I'm going to start completely on the right. On the right of the table, we have Anders. Anders is the ambassador for global health from Sweden, but also holding the EU presidency for the European Union. And then next to Anders is sitting Charles Ibinjera from Makerere University, but also very important, I believe Charles was the president for the Regional Health Summit last year in Uganda. So coming here to Washington and seeing what is happening. So hopefully also he can share us some very important perspectives from that side. Then we move next to Charles, we have Michele from the World Bank. Very happy to have Michele here, manager for Latin America on health, nutrition, and population global practice. And then next to him, we have Oksana. Oksana is the WHO representative to the European Union, or we call it the ambassador, in fact, for WHO to the EU. And then we have Fionn. Fionn is from, if I may say, sitting on behalf of Global Health Advocates, so giving the civil society perspective of this discussion. And then next to Fionn, we have James. James is the director for health systems and services from PAHO. So this is a very interesting panel, and we are very pleased to have you all here on the table. In fact, I was counting the numbers, and we did have a big discussion a bit before. We have, in fact, the biggest table because we really wanted to have a balanced debate on this topic. So I know it's a lot of speakers, but bear with us. I think the insights that you will hear are important and are really to be thought about and to be discussed. So here we are to shape a new global health order through a more strategic, assertive, and effective engagement, and really expanding regional partnerships in health. We really want to take the EU Global Health Strategy as a conversation starter. Of course, we acknowledge we are here in Washington, D.C. We know that maybe not all of you have heard about the EU Global Health Strategy, but of course, this is the role of the discussion today, because we believe it shows considerable emphasis on partnerships, investments, innovative financial instruments, and collaboration with the private sector and civil society. So therefore, I would like to open the floor really and go directly to our panel members. What I will do is I will ask each panel member a question, and then we have some time for interaction with the floor. And then if we have some time left, maybe I will go back and deepen a bit more some of the questions. So I'm going to look to Anders now. And Anders, you were really the first global health ambassador, I believe, in the world. And currently you're also holding the EU presidency. Could you share with us your view on why you believe the world needs to draft new EU global health strategy and what is really different to it? Anders, you have around 8 minutes, but I'm sure it will be fine. Over to you.
Okay, thank you very much. Perhaps possibly I should start by saying that EU is not the world. And I will come to that is also something new with this strategy for global health that the European Commission and its member states are now working on to get a political agreement on. But let me come to that, what is different in terms of also, of course, the European Union working with the rest of the world, especially with the African Union, but also across the Atlantic. So we had a discussion this morning about the transatlantic relationships that are, of course, of great importance to both the EU and to Sweden. But to answer your question, what is different and why is this strategy important? If we look back, the present strategy is from 2010. And some of you were around then, and you remember that the agenda at that time was about the MDGs. Reducing, I'm seeing Malena here, reducing maternal mortality, child mortality, and the 3 diseases. That was the agenda then. We've been quite successful, and I would say that the EU and its member state, with its resources in totality, has contributed quite a lot to actually now going from, at that time, we lost 20 million people per year. Now we're down to 8 million. So still an unfinished agenda, but if we look back, it's quite an improvement. Still a lot of work to be done. But that was the situation then, focusing on a couple of key priorities. Today, the world is different. So the health needs are different. So if one begins with that, what is different now compared to then is that we have still an unfinished agenda when it comes to child mortality, maternal mortality, and the 3 diseases, AIDS, TB, malaria, and tuberculosis. But the amount of non-communicable diseases are, and I see Bente here from WHO, is increasing. So we're losing 17 million people prematurely each year in the world. 85% of those are in low and middle income countries. This is a different agenda that we are still not internalizing enough, I would say. So this strategy should be seen in the light of what is really affecting people's health. And it's no longer good enough to do the old MDG agenda. We need now to do both, in some way, the double burden of disease that we see in very many countries. And that's why also the agenda looks like it does. What, of course, has influenced also the EU strategy and why we needed a new strategy is, of course, the lessons now from the pandemic. That we have had a big outbreak that basically paralyzed the world. We will have new outbreaks, no question about that. Those will come. The question is whether we can manage them better next time. What we also saw during this outbreak was that you need security. You need access to basic service. You need universal health coverage. This was a matter of life and death, but it's also critical to the spread of the COVID virus during this pandemic. So basically, the new strategy now is building on the 3 WHO pillars, saying first, ensure that we prevent people from falling sick, and a clear message here that if we're going to achieve that, the health sector is not good enough. We need here to work on people, colleagues doing climate, doing food, doing city-urban planning. There is where we have the major determinants of health. So the strategy is clear that this is no longer a health strategy, meaning a health sector strategy, it's a health strategy. The second priority and second pillar is about universal health coverage. And then from my sort of Swedish side, very happy to see that there is a strong focus there on sexual reproductive health and rights. And the last one is then also saying that we need also to work proactively preventing now new outbreaks from becoming this kind of pandemics that we see now, but also dealing with a big challenge that we have in the world, which is AMR, resistance to antibiotics or other medical treatments. So that's the agenda. So that is new. So there's a different content compared to the past. And the reason for this is that the health needs have changed or are still changing. But there are 2 other reasons why we needed a new strategy. The old strategy and the old sort of paradigm was basically that the EU was helping Africa. No longer. We need to work together. We have seen what has happened during the COVID pandemic. The political interest, the political commitment to health in the African region has increased enormously. The African CDC is at a totally different level than what we saw in the past. So when I've been interacting, not with you, but other colleagues from the African CDC and the African Union, I basically, my message to them is saying, are you prepared to work with me in the future? Because I will need you. We need still to work together, dealing with global issues. We still need to have global solutions to certain things, and we need global functions. But those are different from in the past, because in the past, it was about aid, us providing resources to help someone else. I hate the word help. Today, we have a world where we are dependent on each other when it comes to different health challenges, whether it's outbreak of diseases or how the food industry is basically not making the world more healthy. We need to work together, setting rules, regulations, having political agreements, and that we need to do in a different way. So this strategy is also stressing we need a different kind of partnerships than what we have in the past. And the last thing that is different and why we needed a new strategy is that aid is not enough if we're going to deal with health. So this strategy also emphasized the importance of what we do from the European side, bringing in resources from research, being clear about what we do in terms of our climate work is extremely important for people's health. We don't call it health, but the outcome is also positive for people's health. We need to engage the agriculture people much more to have positive agriculture policies that are actually contributing to people's health. So the strategy says that, yes, development assistance is still important and the European continent is still going to contribute, but we are also going to bring to the table other instruments and other sectors than what we have done in the past, recognizing again what is really influencing people's health. So this is basically what is new and why we needed a new strategy: the content, the epidemiology in the world. Second, we need now to have a different kinds of partnerships with partners across the world. And we need also to basically to leverage and to deliver not just development assistance, but also what we do in terms of research, trade, agriculture, etc. Thank you.
Thank you, Anders. That's really good to hear and to understand a bit more on the EU Global Health Strategy and the new elements in there. So now I want to take this a bit more in detail and maybe point to Oksana for the next question, if that's okay, to continue the conversation, because we had just seen the launch of this Global Health Strategy in November in Brussels. But Oksana, could you explain a bit more to us, why is this potentially a game changer for global health as well as for WHO? Does this change the partnership that WHO has with the European Union, and how does it change it? We would like to hear from that. Thank you.
Thank you, Caroline, and warm greetings to everyone from WHO Brussels office. I'd like to thank Anders for setting the scene so well for today's discussions, but not only for this, also for his contributions to global health as a global health ambassador. And these contributions was important during his career, we know, and also he was very much involved in the evaluation of IHR regulation, lesson learned from the pandemic. And I would like also to acknowledge the strong role that Sweden has as a EU Council presidency in taking up the Commission EU Global Health Communication Strategy communication and facilitate the negotiation between member states and build and develop, we hope, strong Council conclusions. Yeah, we really want to see the European Union speaking one voice and a union who empower, the European Commission to implement this strategy, that we really consider that it's a good one, it's a complex one, and we want to see the Commission acting, united in their commitment to improve global health security and deliver better health for all in a changing world. So this is the aim of the strategy. But before I go to this game changer effect and expectation and opportunity of this strategy, I would also like to echo what Anders says about the context of this new strategy. And it's really totally different context than 10 years ago when the Commission had the first EU Global Health Strategy. We live in a polycrisis world and we face so many threats to health, from COVID pandemic, NCD, IMR, rising inequality. We've also the global health goals set out in the context of Sustainable Development Agenda are also increasingly more difficult to reach for the moment. And each of these challenges transcend borders, transcend sectors, languages, ethnicities, and really need global solutions and need partnership, need a synergetic and cooperative manner of work, which is why multilateralism and leadership in global health is so important. And therefore, we welcome so much, the leadership, the renewed commitment of the European Union in global health, because we see European Union as a key global player. And for us, the WHO is one of the key and strategic partner. And Anders remind us about this new, the first EU communication on global health strategy in 2010, we may say that this framework still laid ground for the EU actions today. And that strategy also was very important for us in WHO because it also laid ground for the unwavering support that European Commission gave to WHO as the only, and I quote here, the only international organization that enjoy universal political legitimacy on global health matter. And this is a quote from the President Merkel in very critical time for WHO when we're dealing with Ebola crisis, but we saw also very unwavering support of the European Union during pandemic time. In recent years, the European Union and its member states play really a very important role in global health, and Team Europe become one of the biggest contributors to ACT-A and COVAX facility. It has initiated proposed to the world a new pandemic treaty. So it was the European Union who has initiated this discussion, and it has been at the forefront of establishment of a pandemic fund, which already issued its first call for proposals. We have very rich partnership and very multifaceted partnership with the European Union. For instance, with the European Union funds, we are advancing our work in UHC partnership in more than 120 countries around the world, helping countries to, increase access to health services and financial protection. We have a new initiative, also the European Commission, on vaccine technology transfer and local manufacturing, which we hope will empower African continent to become hubs of innovation and production, and help to lay down the foundation for more resilient, sustainable and economic development across continent. And as you know, WHO is in emergency setting is also operational organization, not only normative settings organization. And with the European Union, we have also very rich partnership in many emergency settings in the world. And we heard today in the morning, our regional director, Hans Kluge, speaking about our cooperation in Ukraine, for instance, where we together with European Union, local authorities, national authorities, with communities, contributing to help, Ukrainians to get access to services and to make health system remain resilient. And we expect that this new strategy will open new opportunities for global health through enhanced European Union leadership, through reassess responsibility for global health and for global challenges, through reinforced advocacy for health in all policies, but also we see this an opportunity for resource mobilization. And we at WHO are very pleased to see first that these strategies' key priorities are very much aligned with WHO triple target for better health and well-being, for UHC and for health security, but also with our key 5 priorities or key 5 directions that our Director General has presented during the World Health Assembly. And these directions are promoting health and preventing diseases, and understood that this is one of the priority of this strategy is about providing health through strong primary health care as foundation for universal health coverage. This is also protecting health through enhancing global health architecture for health preparedness, response and resilience. This is also for empowering health through harnessing science, research, innovation, digital, artificial intelligence, and for performing for health, which by building a strong and sustainable finance World Health Organization. And we see this close EU alignment with WHO, but also with UN priorities as an important game-changing element and opportunity to accelerate health-related SDG as both HQ and regional level, at both levels, we have set the course, transformation course and pathway toward reaching SDGs. This pathway is firmly anchored in our programmatic work, which is also guided by evidence and measurement of impact. The second game changer that we see that European Union is really going to lead by example, and would like to position itself as a strategic partner, merely like a development partner. But when we speak about leading by example, I really would like to underline, this nexus that we see in the Commission communication between, the building internal capacity for preparedness and response, and better prepare for health security, and by building so-called European Health Union, and an external pillar of this European Health Union, so-called EU Global Health Strategy. Here we see, the twin duty of the European Union to really manage to transform itself, to build internal capacity for health security, but also to leveraging the responsibility toward the entire world. We're also very pleased to see that European Union want to promote a coherent global health diplomacy, including strengthening health diplomacy capacity of EU delegation. And also, Anders, I like your question in the morning, and our regional director has also answered about our plan to build capacity on health diplomacy in WHO, but also in member states in the region. And here we would like also to partner with United States and other countries who has really good examples in health diplomacy, because we really believe that health diplomacy can generate, very positive outcome for global health. Then we have also optimistic expectation for the EU role to enhance financing for global health, but also to increase health investment efficiency. And we see the role of the European Union not only as a donor itself, but also as a catalyzer, which bring together, pool resources for many partners and lead also by examples. And we're glad to see that the European investment strategy, so-called Global Gateway, has as one of its main pillar also health. So we are going to see increased investment in health infrastructure and health regulatory framework through this Global Gateway. And we also hope that now through the new revision of the MFF, so-called MFF of budgetary midterm review of the European Union will also revise the funding for health, and will link the new priority of global health strategy with funding. We, of course, not last but not least, we welcome the EU ambition to further contribute in a more strategic way to shape the global health architecture with WHO at its core. The European Union strategy is very clear on the position of WHO at the center of global health architecture. We, of course, we welcome this, and therefore the presence of our Director General at the launch of the EU communication in Brussels was also quite symbolic, because we really are grateful to the European Union for this unwavering support. And we expect also this strategy to give new impetus for our partnership with WHO partnership cooperation at all levels through more strategic alignment. And there is a clear references in this document how the European Union want also to partner with us, WHO, based on the mapping of our activities, so more in a more focused way. And we are open for this. But of course, we have been also very actively involved in the development of this strategy in the consultation process, and we are very grateful for the Commission for really the transparency that follow this development of the EU Global Health Strategy.
Great, thank you, Oksana. I think now we understand a bit more on the EU Global Health Strategy and the implications maybe for WHO. So Charles, may I now come to you with a bit more of a, I would say, a tricky question, in the sense that, if I may say, I think global health policy has long been criticized for colonial legacies and tendencies to really promote biomedical solutions. But do you see a trajectory of change towards engagement on global health from your perspective, being based in the global south, if I may say so? Could you share us your views on if this is really a new partnership, or give us some of your insights on recommendations on what we are discussing today? Over to you, Charles.
Yeah, thank you very much for the opportunity, and I would like to appreciate what has been said by my fellow panelists on the new strategy. The issue of that question, I think, is still pregnant, and we have to prove. But I think we are aware that for a long time, global health has been engrossed in colonization. And some circles, it's very difficult to separate it from the colonial legacies. But with the increasing autonomy of the countries in the South, there has come up advocacy for decolonization. I think that is the catchword in the recent times. And decolonization approaches to global health. So those ideas and patterns and practices are still a challenge to attainment of global health goals. I think you'll bear with me that despite the loads of aid, as Anderson put it, there has been little change in achieving some of the targets in the global south. And you are aware that during COVID, it became very evident that there is a high magnitude of inequalities in there was a high magnitude of inequalities in mitigating the pandemic risks on distribution of vaccines and other interventions from the global north to the south. Now, this was not different. So the question that, do you see a trajectory of change towards the engagement on global health from your perspective? There are a number of players who have used different strategies and who have made an impact on the global south. And if the new strategy of the recent EU strategy assumes those strategies, I think it is likely to change the trajectory of support and the trajectory of doing things in the global south. Of course, we appreciate what is happening by EU strategy in supporting multilateralism, and particularly WHO and other agencies that support global health in the south. And Therefore, the new EU Global Health Strategy is highly welcome as it comes with better objectives and approaches. We hope that these objectives and approaches have really been long studied and pick from what has worked and what has not worked, especially focusing on partnerships as part of the global gateway based on a number of things. And one of these is co-ownership, not just bringing aid and it is aid, but you bring aid and you involve the local communities and they become equal players and partners. So co-ownership might be a game changer. Also, co-responsibility. I mean, allowing the local communities, allowing the local policy engagements to own and use the support from partners may also prove to be a great game changer. And this will in turn improve the health sovereignty of the South, and it will ensure more resilience and autonomy, because you are going to come, you'll support the building of the local systems, they become owners and they grow into it, and therefore they will know, they regard it seriously and promote, and that will promote resilience. And to achieve this trajectory of change and create impact, the methodology of implementation must change, leaving behind the past practices and focusing on equal partnership, collaboration, and support that genuinely addresses the local context of health in the global South. Some of such examples are very vivid. For example, in Uganda, we had an Ebola attack. And because of the support we've been getting and building capacity and owning that capacity, we were able to mitigate and control the Ebola attack in 3 months, and it did not spread to anywhere else. And that is an example of giving support, using the local structures and allowing the people to own and use that to develop resilience in health. So addressing the local context of health is very, very key. And also we think one has to allow restructuring of the governance of the relationships that shape and drive global health. That is very, very important. Restructuring the governance of the relationship. Not that you are bringing support or aid and you will manage it from A to Z. But if you can restructure how that is going to be used, and you allow local leadership to be involved, there will be local ownership, and that will build resilience. And so that will change the trajectory of global health in the global South, and it will build resilience, resilient health systems, and will also address the local agenda, because the local agenda is generated in the South. It is not generated in the EU, it is generated in the South, and the support you give is to drive that agenda to attain those local objectives and I think by so doing, we can look forward to attaining universal health coverage and many other targets that have been out of reach for a very long time.
Thank you so much. This is very interesting to hear, and I'm hoping to have a bit of a discussion after this. But let us move now to Michele from the World Bank. Can you share maybe your thoughts, if we may say, from an important body like the World Bank? How do you consider development financing and technical assistance? How in global health should it look like? I mean, we are here today, but we know a few blocks away, we are having the spring meeting, and we had heard a lot today about ministers of finance and how to engage with them. Are you aware of any efforts or discussions on global health that is taking place now in the spring meetings? Or do you have any advice for us? Because we, of course, know that the World Bank has put forward in recovery and resilience. And of course, we have heard about the pandemic fund. But is there any appetite, if I may say, for investing in prevention? Do you have a special force for us to do more? And how could we trigger the non-health sector? So we're really interested to hear from you and get your advice. And maybe after this, we also want to step down with concrete engagement and maybe next year present to you how this panel managed some concrete examples of partnership after this. So a big responsibility to you, but we look forward to hearing from you, Michele.
No, thank you very much, first of all, for the invitation and for the question, which is, of course, a complex one, but I'm happy to give some initial answers. In my opinion, you have raised three issues. The first is about the vision for development, financing and technical assistance in global health. And of course, it's very timely, and it's very timely for us in the bank. The recent pandemic has reminded all of us, even though those who were not as focused on health, of how critical countries' health systems are, not only for good health of their population, but also for good functioning of their economies and societies. At the same time, the pandemic exposed the weaknesses of health systems and public health systems, in particular, even in countries with most advanced development. And everywhere, a discussion has started about what to do next. Certainly in the LAC region, about indeed developing and implementing a new strategy for the health sector. Health for the bank is a very important area of investment, and increasingly so. The World Bank is, at this point, I believe, the largest investor in health systems, with a portfolio of $34 billion globally, and more than 200 projects, which are the vehicles that we use to transfer financing to our client countries. And the portfolio has increased threefold during the past 5 years, and it's roughly evenly distributed across the full spectrum of countries, from the poorer to the upper middle income countries. At the same time, the question is also relevant because the health landscape, as has been explained very clearly by the previous panelists, has changed, and has changed very, very fast. It is also much more interconnected with other sectors than before, as you were also saying. And in this context, the World Bank right now is in the process of developing a new institutional evolution roadmap that is proposing to change, quite importantly, our business model, and is proposing a major push in 3 directions that are all related to global health. The first is about scaling up the ongoing model that is transferring resources to countries. And especially in the context of the reversal of hard-won gains due to the overlapping crisis that you were mentioning, including for population health and health systems, and especially so for the vulnerable groups, which have been disproportionately affected. And the World Bank is trying to leverage more its financial capacity to increase financing and the efficiency of its operational model with an emphasis on sustainability, resilience, and inclusion. The big change is about tackling the cross-border global challenges, the global public good agenda, and especially related to climate change, pandemics and health security, and fragility and conflict. So right now, again, the World Bank is among the largest providers of climate financing to developing countries, and more has been said, that there is a recognition that climate change matters tremendously for health. And but also there is the global public good agenda is about stepping up efforts on health issues like food security, water, energy access with an equity and gender lens. Knowledge is critical, is the ultimate public good, and there is indeed, it's been part, we think of the bank as a knowledge bank as well, and the emphasis now is about evolving towards more tangible cross-country developments of global or regional public goods, for example, around epidemiological surveillance or production capacity for key health technologies, including vaccines, work that PAHO has been leading in the region. And then it's, of course, as it has been mentioned, a multi-crisis environment that we are living in, and the need to prevent, prepare, and respond to crises. Here again, specifically for health, with PAHO, we are developing a joint proposal to understand the new roles and functions of primary healthcare, which I think everybody agrees is foundational for the establishment of sustainable, effective, equitable health systems, and try to understand how primary healthcare can help prevent, prepare, and respond to public health risks and emergencies of different sort. The second issue that you raised is about the pandemic fund and prevention more broadly. And you know, the pandemic fund is now up and running. We have received the expression of interest after the first call of proposals, and you know, clearly there is need for much more financing than what is available, and countries seem ready to take action. But I'm not going to say much about the pandemic fund. We can answer questions later. But you know, as Anders was saying, because of the progress made, but also, you know, there has been an important change in the epidemiological profile that has now shifted towards non-communicable diseases in most countries. And in this context, indeed, you know, investing in prevention has become even more of a priority. And the approach we take always in following the leadership of WHO is indeed to strengthen primary healthcare systems as the foundation to expand prevention services in a cost-effective manners. And many countries in LAC have started reforms to move towards that. Chile, in our opinion, is really probably one of the best examples, but the discussion is happening in many other countries. At the same time, as you mentioned, you know, action for better health outcomes are needed outside of the health sector. In the bank, we work, us who work in health, try to do what we can to coordinate, collaborate, bring synergy with water and sanitation, social protection, transport, which, you know, is not easy. Of course, more should and can be done, but at least there is, I think, full recognition by everybody and willingness from everybody to do more. What we have been done more systematically in the bank has been to work with our economics and fiscal teams, especially on health taxes for tobacco, alcohol, and sugar-sweetened beverages, and to promote healthy diets. We know, for example, that obesity, the prevalence of obesity is among the highest in the world, especially in Mexico and in Central America, but across the region, there has been good progress, but these are very complex questions from a technical and political point of view. So definitely more work is needed. And then the third area you raised is about further discussions about global health with ministers of finance. And indeed, you know, like it's a fertile environment to have these discussions, and at the spring meetings, the spring meetings offer a good platform for that. It's also a difficult question because you know the crisis has exposed weaknesses not only of the health system but of other very critical functions of governments and societies. Think of education, for instance. And this is happening at a time when the fiscal capacity of countries is not so strong. You know, the projection we make are that countries may be unlikely to reach the same level of spending before the pandemic for health. You know, and so these are difficult questions. We are working closely with ministers of finance and ministers of health jointly in the G7 and G20 Joint Finance and Health Task Force. With WHO, we are co-convener of the Global Preparedness and Monitoring Board, which is an independent advocacy and monitoring group for health security and preparedness. And it's a very important partnership for the years to come. So to conclude, I want to say that we are strong believers in partnerships, not only with the countries that are our client countries and are always in the leadership of the discussions they have with the bank, but also with all the other stakeholders in the global health space. In the case of PAHO, I think the COVID pandemic offered the opportunity to learn and appreciate the value they bring to the region, and the partnership has now expanded to many more dimensions of health system strengthening. And it's a pleasure to learn more of the new EU's global health strategy, and also the attention that you are putting to the Latin American and Caribbean region. So we are, by the way, 100% aligned with the pillars you described of the strategy. So I hope indeed this will be the first of a series of meetings where we can come with concrete steps for coordination.
Thank you. So let's see. I mean, maybe now, James, it's the time to hear a bit more from PAHO. We are, of course, here in Washington, and we talked a lot about the EU global strategy, but we would love to hear from you how you are leading in PAHO, how you have translated global health priorities into regional policy actions. So could you share with us how you have taken steps to advance UHC to maybe innovation, research and development of vaccines, medicines and other health technologies, with of course a focus, I suppose, on primary healthcare. It would be really great to hear your thoughts and your insights, and to see if we can also learn from that and take that forward into action in other regions maybe as well. Over to you, James.
Yeah. So thanks so much, and thanks also to the other panelists for their contributions. I think, you know, the region has really benefited from discussions globally around some of the main principal agendas and drivers of agendas in global health over the past 20 years, even going back to Astana, when we really had profound discussions around what primary healthcare means and how that then permeated into the region. If we look more recently in the UHC agenda, the 2010 document on financing universal health coverage, that came into the region, and that really a question was posed to many of our countries about what universal health coverage means within the context of health systems, where the right to health is enshrined either at the constitutional level or at the legislative level. And so that instigated a profound discussion within countries in the Americas, leading to a strategy which we refer to as the Universal Health Strategy, where it was considered that the concept of coverage is necessary but insufficient in order to address the comprehensive needs of people, and where the issue of fundamental access, breaking down the barriers to access and addressing the inequities and inequalities that exist within countries was key to that. We've also seen global, how the global health agenda and health workforce has permeated into the region, be it through the 2030 Workforce Initiative, but now more recently with the presidential initiative announced by President Biden with PAHO on the America's Health Corps, and the commitment to really address issues around access to qualified health workforce where they are needed, and particularly at the primary care level. This is really going to be something very important. But I wanted also to mention that the concept of global health agendas permeating into the region is a bit of a misnomer, because what really happens is this is a bubbling pot of many countries working collectively together and feeding into the global level. And so this concept of top-down into the regions is not often what happens. We've seen the region in 2016 around the discussions of Ebola and the Zika outbreaks, presenting resilience platforms and renewal of the essential public health functions, which then fed into WHO governing bodies. We've seen the virtual campus in terms of the capacity development of health workers. We have an educational platform in the region with now over 2.2 million health workers participating from all countries in the Americas, which we really effectively leveraged to rapidly scale capacity in COVID detection, care, and management during the pandemic, with over 1.9 million persons trained through that campus in the Americas. And we see how that feeds into the WHO economy. And we see the dialogues around G20 between health and finance now permeating, and how the economic and health dialogue of the Americas is feeding into that. So the region has been a hub of social innovation, of policy innovation, that has also fed into the global level and has allowed, I think, other regional offices, regions, countries to learn from the region. And I think our next step is, as Michele well mentioned, is really around the innovation in primary healthcare and how we take that next step in terms of primary healthcare as the core foundation for building resilience, but also expanding comprehensive access to health in the Americas, and fully integrating the digital health platforms and digital health transformation that we need to take care of now. I did want to speak to the second point also that you raised, and this, we also see how this region, I think, in terms of medicines and technologies, has been at much of the forefront in terms of the global debate and discussions, be it whether it's the more complex issues around public health, innovation, and intellectual property, going back to 2008. We all remember those very difficult discussions within WHO governing bodies, but more practically in terms of the revolving fund mechanisms that have been established by the organization, either to deploy vaccines to immunization programs to facilitate and maintain coverage levels within immunization, or more recently, the strategic fund that leverages access to public health supplies for HIV, TB, malaria, and now moving into the NCD arenas. It's that solidarity of commitment of countries working together jointly with the Secretariat that really has allowed us to rapidly scale initiatives, be it through HIV, treatment 2.0, malaria elimination. And now what we're going to do is really focus and see how we can leverage that experience and capacity in the NCD arena as well. So we have the revolving funds, we have the regulatory systems also in the Americas. We have a long tradition of working with national regulatory authorities. We have a network of the regulatory authorities that meets on a regular basis. We have 8 reference national regulatory authorities that meet twice a year with PAHO. And these regulators essentially cover 80% of the population of the Americas and work then collectively with regions, sub-regions such as the Caribbean or Central America. And so these 2 initial areas of work within medicines and technologies allowed us then to develop the third, which was very became very apparent that was much needed during the pandemic, and that is the regional platform for the production of COVID-19 vaccines and other health technologies. I think, as Charles mentioned, the enormous inequities and lack of timeliness in the availability of diagnostics, of PPEs, and of vaccines to lower middle income countries really highlighted an enormous call to action, I think, in the Americas for us to begin to look at how the region can build and leverage the installed research and development capacity, science and technology, industrial capacity to begin to build and contribute, obviously, to global health as well. So we launched the regional platform for the production of COVID-19 vaccines, medicines, and other health technologies in 2021. Very actively engaged in the WHO hub. We have actors that are now participating in the tech transfer initiatives with Afrigen and the South Americans. But apart from that, we have other initiatives. We have major studies ongoing to identify gaps in the markets, market failure analysis, how technology transfer has worked or has not worked in really installing technology within the region. The inequities associated with that. Is fill and finish really technology transfer? And then other areas of work where we basically need to leverage the capacity of regulators to ensure the quality of basic PPEs. This was a major and fundamental issue at the beginning of the pandemic. And so we've established regional hubs also to look at the assessment of that. I think we are very lucky in our region to have very strong partnerships, which you mentioned. This work has been obviously developed collectively with the countries, but we have our partners such as the World Bank and the IDB. We have the US government, Canada, and the European Commission that is financing significantly this work because it is a priority. And we fully believe that the Americas can not just build its own capacity to address its need, but can actively reach out and contribute and support the overarching objectives relation to the Sustainable Development Goals, and particularly in some of the areas and the knowledge that we have moving forward. So I'll stop there. Thank you.
Thank you. Thank you. And now, last but not least, that's very important also for us to keep grounded and to really hear from you, Fionn, from civil society perspective, because at least in the Brussels bubble, as we say, civil society has been very active in global health. In fact, they were even the first to publish a global health shadow report on it. Now we have seen that, you know, the global health discussion is much more on the table. I would say maybe it is a bit top down, but still there is an engagement more in global health. What do you believe is needed for action on global health? And how could we make global health more locally? Do you have any advice for us or any input that you could share with us? Please, Fionn, over to you.
Well, firstly, thank you very much for having us here as part of the panel. I know I'm standing between you and the Q&A session and the beautiful sunshine outside, so I'll try to be quite succinct, but I am here representing a coalition of NGOs active on global health in Brussels, so I will try to make sure that I represent all of their voices. You don't hear me? Okay. My parents would say that I usually speak very loudly, so hopefully you can hear me. So indeed, global health NGOs were very active in Brussels, calling for a renewal of the EU's strategy, even publishing a shadow strategy. And so we're very happy to see this renewal of the EU's global health strategy, which was indeed outdated and failed to significantly address major global health issues, including sexual and reproductive health and rights, for example. I think it's good to take a pause and to celebrate the strategy and to highlight some of the things we're very happy to see. But as civil society organizations, we are always striving for better. So it would be remiss of me not to suggest some areas where we would like to see improvement. So it's great to see that the strategy includes strong language on keeping global health challenges high on the global agenda, and includes key actions on closing global health governance gaps, including, importantly, by strengthening the World Health Organization. Also, from a financial point of view, it's great to see the strategy is encouraging member states to increase financing for global health and also encouraging the use of innovative financing instruments. And also, again, as Anders pointed out, really great to see that the strategy is rooted in a One Health approach and calls for a health in all policies approach and a more coherent and integrated EU response to tackling global health. So where do we see room for improvement, and what do we believe is needed really for this strategy to be more than a map for global health action and to really deliver on the priorities that it sets out? Anders mentioned that this is an opportunity to put the lessons learned from the pandemic into action. And one of the main lessons learned from the pandemic was the need to address global health inequity in access to new tools. But we see here immediately maybe a lesson not being learned, and we are very disappointed to hear that the draft council conclusions are very silent on the Commission's call in the strategy for the creation of a permanent global mechanism for equitable access to vaccines and other countermeasures for low and middle income countries. Similarly, while the strategy has a broad commitment to ensuring that international trade policy works for global health, it says little on intellectual property, as do the draft council conclusions, a missed opportunity again to put lessons into learning into action and to take responsibility, ensuring local production in low and middle income countries, including through TRIPS flexibilities. And as mentioned, and research has been mentioned, research and innovation is also another policy area where the EU can put a stronger emphasis on global health. When we look at health in all policies, the EU is currently revising its pharmaceutical strategy and is expected to include incentives for research and innovation. But leaks suggest that global health issues such as neglected tropical diseases are not considered as part of this area of unmet medical needs. So again, not seeing necessarily the ambitions in the strategy in reality. So 3 areas for action, let's say, from us. First of all is the need for bigger and better funding for global health. The strategy is not accompanied by new funding, and so the ambitions set out will not be achieved without more ambitious and better funding. Despite being a leader on global health, and we see that in the presentation of this new strategy, we are seeing the EU's ODA for health is fairly low, especially when we look or compare with the UK, for example. Only 5% of the EU's ODA goes to health. The UK 15%, and here in the US it's 29%. So need to see an increase there. The EU's current MFF, its multi-financial framework, its budget was designed pre-pandemic, and budgets foreseen for support to important multilateral initiatives have been depleted by unforeseen but necessary support to Act A. So while the strategy calls for a welcome prioritization of global health across all EU financing programs, it has remained quiet on leveraging the midterm review of the multi-financial framework to increase the total budgetary resources available. The future MFF that will be coming post-2027 must also translate global health strategies ambitions into more ambitious funding in new programs. And for that to happen, it's really important, going back to my first point, that global health remains a key political priority, also for the new set of EU institutions, as we will have elections in Brussels in 2024 next year. So more money and more ambitious and innovative funding will really be necessary to transform the words of the strategy into action. Talking numbers as well, so from funding also to monitoring and evaluation. What gets measured gets done. So it's great to see that the strategy includes a strong start for a permanent monitoring and evaluation instrument that includes metrics and key indicators that were built on this year. We'd like to see the strategy's accountability mechanism also define clear targets and milestones that align the EU's foreseen outputs with the desired outcomes of partner countries. We're pleased to see that the Commission is following up on this, and as a coalition, as we put out a shadow strategy, we're also proactively working to produce suggestions and recommendations on a monitoring and evaluation framework that can be used to measure the implementation of the strategy. We believe that civil society and communities must be fully involved in the monitoring of the strategy and also in its implementation. And this comes to, this brings me to my third and final point, which is the importance of civil society organizations, of youth organizations, communities, research organizations, patient organizations, academia, both in the measuring of the implementation, but also in the implementation itself. It's great that the strategy takes a strong approach to fairer and more strategic partnerships, and this will be crucial to move away from the aid-based approach to global health. But we really need to see some of the values of equity and inclusion set out in the strategy really be at the heart of the partnerships delivering on the ambitions of the global health strategy. And so those values will remain empty promises if there is no meaningful and inclusive involvement of a broad group of stakeholders in the monitoring and the implementation of the strategy. So those are our suggestions and action as to how to deliver the ambitions of the new strategy.
Thank you. Thank you. Now I would like to open the floor for questions maybe. So is there any questions from the floor? Yeah, the gentleman there. Thank you.
Hi, Quentin Knight from Vanderbilt University. I have two questions. One thing I've noticed quite a bit, especially with the United States funding agencies, CDC, NIH, NIAID, is there's increasingly less and less funding for capacity building projects, and it's all going for hardcore research. So I'm curious what comments you have about that, and whether the agencies you're speaking about are trending in that direction as well. And the second question I have is for the World Bank, and I may be ignorant about this, so forgive me, but the World Bank deals with mostly governments, ministers of health, and very high-level agencies. Whereas a lot of good global health work is done by people lower down that hierarchy. Does the World Bank have any mechanism for dealing with people lower down the hierarchy and dispensing funds in that direction or not?
Okay. Any other questions? Maybe we take a few. Let's go for the gender balance, maybe in the back. Maybe, yeah.
Thank you very much for this interesting discussion. My name is Tarita Baldan. I work with Global Health Advocates. I'm here this week also attending the World Bank Spring meetings, where I do feel there has been little discussions when it comes to how we can improve the World Bank's modalities to improve health for all. JHA has recently published a discussion paper entitled Making It Work, What Role for Multilateral Development Banks in Achieving Health for All. Although we do acknowledge that multilateral development banks are key players and really needed to support global health, there are a few caveats when it comes to the role that they play and how they are increasing privatization of healthcare, and their lack of accountability, lack of inclusion of civil society. So I have two questions. First, for the World Bank. What do you think that should be changed with the evolution roadmap to really ensure that the World Bank really delivers health for all? And how can the World Bank better work with other multilateral development banks, such as the European Investment Bank, a key partner of Global Gateway? And second, to Mr. Nordstrom, as my colleague Fion mentioned, the global health strategy does not, unfortunately, comes with financing attached to it. So what role can the European Investment Bank have to leverage domestic resource mobilization to really achieve health sovereignty? Thank you.
Thank you. Maybe we take two more questions and then we, yeah.
Hi, my name is Anna. I'm a master's student at George Washington University. And so given the kind of environment post-COVID, I do feel like there was a really big spotlight kind of put on global health and organizations. And I was just curious about how, this is a little bit of a simpler question, but it is loaded. Given the COVID pandemic and the chaos that's kind of ensued with it, do you believe that it's that the new kind of intense spotlight on all of these different organizations in the public eye, and given, you know, communications with the public, has gotten a little bit more challenging to allocate funding, kind of implement programs, given people being maybe a little bit more involved in global health and kind of really taking a good look? You know, people sit back and kind of know more what you guys do. Has it gotten easier or more challenging to do your work and implement policy and, you know, create new strategies and be innovative? Are people looking, you know, looking for more conservative strategies and kind of pushing towards more conservatism with funding allocation and just kind of feelings like that out of the general public, since I feel at least there's more more awareness in global health in recent years.
Mm-hmm. Let's take one more and then we go back and then we come back.
Hello, I'm Greg Downs. I'm CEO of Federally Qualified Health Center, one of the largest in Southeast. I've been there for 22 years. Obviously, during the pandemic, we had our hands full. We did nearly 1 million COVID tests, but now we're getting back to chronic disease management and regular primary care. One of the things I'm working on now in the latter parts of my career, looking to take the lessons learned from FQHCs in operating in rural environments and take that knowledge to rural parts of other parts of the world. We've done some on-site trainings from bringing people into America and into North Carolina. I've asked for and begged for any advice. Any of you raise your hand, tell me you'll advise me on how we can fund this. We've largely been doing this out of our own pockets. And we have established an FQH, have established a nonprofit American Rural Health Institute. I'd like some advice from you. We are getting some federal funding right now, but we need to expand that.
Thank you. Maybe if it's okay, I would stop here because we have already quite a list of questions. And if it's okay, maybe let's start with the question on if we see a same trend that is happening in the US. You said, you know, on the shift. Maybe can I say if we could hear from Anders on this, or Oksana and Charles on that matter, if you wish to go into that detail. And then maybe from the World Bank we heard about, do you have some kind of an engagement forum, or what is your advice? And also, how is this change evolution roadmap really coming up to make a change and your work with the EEB or other banks. And then maybe from Paho, it will be also good to hear on the last question. And then maybe Fionn and maybe also Oksana on the changing of the spotlight with public health agencies, you know, being more in the spotlight. What do you see a change? So maybe if we could start with Anders, and if you feel that you want to answer some other questions, please go ahead. And yeah, over to you, and then we come back to this side.
No, thank you. Providing vaccines is easy. Dealing with health is much more complex. And I think that is also a good illustration in terms of where what can call global health is today. We have had easy solutions and we made progress. Today, we have a more complex reality that is, of course, much more difficult to navigate in. And a couple of comments here relating to the question about capacity building funding. And I said a few words about this. I think we need a mind shift here. What we need is no longer aid. I'm going to be very blunt. What we need is cooperation. And I'm going to say why. Because what has happened in countries is that we see increased capacity. Makerere University has been working with my school of medicine, the Karolinska Institute, for many years, dual exams and dual interest. The Karolinska is not doing this because they would like to help Makerere. They would like to jointly produce a good cadre of researchers and good research. And they are interdependent on each other. That's the world of today. And this is a mind shift. Are we helping them, or are we dependent on working together? And again, the kind of health needs we have in the world today is not the outbreak of diseases. The big pandemics are the NCDs, obesities, diabetes. Again, when my school, the Karolinska, is going to do research on diabetes, who are they working with? They are working with India. Are they doing that with aid money? No, research money. Because this is where they can do the best research. They get the best cohorts and working with the best researchers in the world. They work with India today, no longer the US only. So this is a change of minds I think we need. And this comes also to funding. If you look at the total amount that is spent from overseas development assistance, it's tiny out of total spending on health. Still, when we're speaking about global health, we are coming back to that the EU strategy is not providing enough money to pay for this. No, of course not, and it shouldn't. The money today are coming from governments themselves, and that's the big advantage, the big progress. What we saw now in the African region when it comes to setting up the African CDC, domestic regional resources, not international resources. Resources when there was the gap of vaccine coming from the African continent, brilliant. And we need more of that, of course. But then we still need to work together at the global level. We still need certain global functions to work together. So I'm not only because I've been an ambassador for global health for 13 years that I still are quite attached to the world global health words and the understanding of global health, but we still need global work together when it comes to setting norms, standards, doing monitoring, having political agreements, setting the rules of the game for the world, and then also telling the world how well are we doing. So there are definitely need for global cooperation, even if now a lot what we did when I started this 30 years ago, when it was aid and development countries, a lot of that, of course, the capacity is there in countries today. And the resources are there. Some countries could do better when they are not taxating the business enough, when the money are going out of the country then for other purposes and for other reasons. So, I mean, there is still room for improvements in quite a few countries to increase the spending on health, domestic spending on health, not international spending on health. Having said that, I mean, if you just look from the European Commission now, there's 1.2 billion euro going for the investment of vaccine and pharmaceutical production capacities in Africa. 1.2 billion on the table right now. So there are still resources. But I think we are still in an old paradigm of thinking in terms of global health. And we need to rethink, and we need to be interested in seeing how we can move from a world that was then 30 years ago when I started this, and where we are today, and where we should go, and what should be our ambition. And that is, again, why I was saying when I was speaking to another colleagues from the African Union, will you be prepared to work with me in the future? Because we are in some way the ones that are politically falling behind. And I think we need to bring in that reality in terms of our thinking. So capacity building, yes, but not finance from aid. Capacity building because we have a mutual interest in this. And then, of course, you need to think about who's going to finance it. And then, of course, you need to think about how governments are financing research, how governments are financing education, how governments are financing whatever it is, and seeing that there is an international dimension to that, and that we have an interest to work and collaborate globally. Thank you.
Thank you very much. I'll just add from where he stopped that it's not capacity building as such, because there is some level of capacity in many countries, but it could be capacity strengthening. And with global health, it's not about supremacy, it's about sustaining and giving equal opportunity to the lives. All lives matter. And if some lives are not protected, others will also not be protected. So in that spirit, there is need to work together, because we are trying to protect what is most valuable to us, because many health issues have no borders. They don't respect boundaries. And therefore, it's good to exploit their available capacity to help build on what exists. And then by so doing, you can actually protect the world better. Because I think there are some things which can work in some areas and some which can't work in other areas. Thank you.
Thank you for the difficult questions, and I'm clearly just starting the conversation. The World Bank, at least the part of the World Bank group that I work with, works with governments. So it lends money to governments, and the terms are more or less concessional, depending on the income, per capita income level of the countries. So it's really money that belongs to the countries. And what we discussed before, making money available is a design and an implementation process. And most of the projects we do finance last mile activities a lot. There is no project, at least in the Latin America region and the Caribbean region, that is not financing strengthening primary health care, or many are financing community health workers. So these activities are almost always part of what the project is financing. But it's a decision that is made always by the government and assessed by the World Bank. There is also the International Finance Corporation that is working with the private sector, but we do not work directly with the other NGOs or stakeholders. About the question on whether the evolution roadmap will make the projects, the activity, what the bank does more effective, we'll see. Hopefully, what it's aiming to do at this point is allowing for more financing and different financing that also goes to global public good. So just the beginning of the process. We of course value coordination with the other multilateral development bank fully. I don't have direct experience of working with the EIB. I know there are joint activities. In LAC, we work closely with the IDB. It's very difficult to merge financing, but at least we have the projects all supporting a national strategy. And maybe if I can say one question, something about the last question. I found that working during the COVID pandemic has been more difficult than it is now, because the uncertainty, the worries, the political pressure, made governments quite cautious in taking action. I find right now a very conducive environment to discuss changes in the health system. It's always a very difficult thing to do, but I think the environment is a good one.
I'd like to comment on spotlight on public health agencies. And of course, during pandemic, the media attention was quite focused on WHO. And through this perspective, I must say, we saw some positive aspects and advantages. People and authorities had listened to us, so we're quite visible, and our advice, was maybe listened. But on the same time, this exposure also exposed some difficulties that we had as an agency, and it reopened the discussion about the funding of WHO, and we realized that the world had so much expectation from our agency, but when people really heard about our small budget, which is comparable with one a big hospital, then of course it became very clear that we can not deliver with this money according to this expectation. And we're very glad that member state, and particularly the European Union, has opened this discussion, and there was a broad negotiation between member states. And during the last World Health Assembly, the countries all over the world has committed to increase the assessed contributions toward WHO. So the resources that we can flexible use in a flexible manner. And we very much hope that countries will follow up on this commitment. Then on funding, I would agree with my colleagues from NGO that we want to see more concrete resources, maybe also from the European Union, and this why I also expressed this hope that maybe with the revision of MFF, medium financial framework of the European Union, we will see more concrete resources that will be linked with the global health strategy. But on the other hand, I also agree with Anders that it's very important also to look at the efficiency of our investment, and in this way there is a lot of space to do better. Also, we see also an increased commitment from the European Union to work with multilateral banks, and particularly the European Investment Bank. And I want to share our experience that we recently signed an agreement with the European Investment Bank, where and actually we signed a tripartite agreement between European Commission and European Investment Bank and WHO, where this multilateral bank committed to to increase their resources and their investment for health. But of course, we should not forget that these resources are still loans, even if concessional, but still loans, and the countries need to be ready to take this loan and, you know, and to invest in health. And this is another issue, how to convince politicians, you know, to invest in health. But I was very pleased to see also in the EU Global Health Strategy, you know, the big focus on innovating financing, but also it was, you know, an instrument that European wants to explore more. It's actually to convert the debts that countries have toward the European Union into investment in health. And I think this is really a game changer that that could stimulate countries, you know, to invest more in health. So I'll stop here.
Thanks. Yes. So the question on global health as under the spotlight. Indeed, we were seeing health disappear from the EU's political agenda before the pandemic. We had a global health strategy that was over 10 years old at the time. And so we have seen the pandemic put global health on the agenda at EU level with the adoption of this new strategy. What will be important is indeed the financing that will in itself be a political decision, choosing to continue to invest in global health in innovative ways to ensure that the ambitions translate into action. Many of the new mechanisms to tackle global health challenges, including HERA, the new European Health Emergency Response Authority, and the Team Europe initiative on vaccine manufacturing in Africa, are examples of new initiatives and pledges that have been announced since the pandemic, but under a budget framework that did not foresee them. So while we've seen global health be put high on the EU's agenda without commitments to financing the new initiatives and the new ambitions that it details, you know, how sustainable will global health remain on the agenda. We've heard that the member states may not be endorsing, but only welcoming the global health agenda, which causes some concern for us as civil society organizations, as what is the political commitment of member states to truly support global health and deliver the ambitions of the strategy. So we really hope that we will see the member states in the coming weeks make a strong commitment to delivering the ambitions of the strategy and keeping global health on the political agenda.
So let me try and hit two birds with one stone here, and talk about the development banks vis-a-vis domestic financing, and then where the countries are in terms of prioritization and the complex landscape in which we're operating. What we've seen during the pandemic in Latin America and the Caribbean was that countries, by our estimates, mobilized around $112 billion in terms of external financing. That could be now through IMF reprogramming, loans through IDB, World Bank, and mostly geared towards social protection mechanisms. Of that, we estimate only 5 billion directly went to the COVID-19 services delivery, vaccines, PPEs, pandemic. So we can calculate that's about 3 to 4% of the total estimate. And that really, I think, really highlights for us, as this financing now is falling off significantly, it really highlights the importance of domestic financing. The region of the Americas has traditionally had low public investment in health. We've only seen increases, despite the commitments from countries. We've only seen increases from 3.7% of public investment in health, public expenditure in health, to 4.9%. And that's 1% below the benchmark that the countries in the Americas set for themselves almost 10 years ago. It's good, it's improving, but we have a long way to go. And so it takes time. It really takes time for us to leverage and continue the advocacy work and work with our partners to really build the national case for increased public financing in health. But from our perspective, that is the principal way to go. And this then feeds into the landscape and working with our partners in complexity, because it's around these issues that we need to build consensus. We don't want to duplicate efforts. We want to seek that complementarity in how we approach our countries. And I think we have very good examples with the development banks, but also with other partners and how we are working. We don't have a big window of opportunity. We have to remember that the next epidemic, pandemic could be around the corner. And so the investments and the efforts that we're making now are really important. We have to recuperate lost public health gains. There are enormous waiting lists in countries. We are going to face a tsunami of NCDs, probably 5, 10, 15 years down the road. And so it's the investments now, that advocacy work, that work around health system strengthening, where countries are really prioritizing. They are now making substantive reform, instigating substantive reform processes around primary healthcare. Chile, Colombia, Barbados, Guyana, I could go on. There are really very interesting initiatives that we need to work and focus. So we can't rest on our laurels coming out of the COVID pandemic now. We need to make sure that the countries are preparing themselves, are building the structures and mechanisms in place so that they can provide access to comprehensive care, but be better prepared for the next time around.
Thank you. Well, initially I said I would open to floor for questions, but I would like to propose that we close because we are a bit over time, and I would like to invite you to go together with us to the reception and maybe continue the discussion with the speakers with a glass of water or something that you wish to take. And please let us give us all a hand for the speakers and the engagement.